Welcome to another episode of the NewsRamp Health, Fitness, and Wellness podcast. I'm your host, Max Newsman, excited to bring you today's top stories. At newsramp.com, we gather the latest business news from the best sources, ensuring you stay updated and engaged. Before we begin, a quick reminder. This podcast features AI-assisted production and voices, but the news we present is genuine, with full stories available on newsramp.com. Today is Wednesday morning, June 4th, 2025, and we've curated a fantastic selection of health, fitness, and wellness news just for you. So whether you're commuting, working out, or just relaxing, stay tuned, and let's dive right in. Let's kick things off with our first headline.
Core Solutions appoints Dr. Michael Aravallo as Director of Clinical Strategy. Core Solutions, Inc. has appointed licensed clinical psychologist Dr. Michael Aravallo as its new Director of Clinical Strategy. Dr. Aravallo will lead the integration of measurement-based care and clinical best practices into Core's electronic health record platform. He will work with product, engineering, and AI teams to develop data-driven solutions that enhance workflows and improve patient outcomes. Dr. Aravallo's responsibilities include defining quality metrics, supporting evidence-based care, ensuring regulatory compliance, and developing training programs for clinicians. His extensive background in clinical and digital health, along with operational leadership, will be valuable in driving real-world outcomes for Core Solutions and its clients. Pediatric growth hormone deficiency, PGHD-1. Pediatric growth hormone deficiency, or PGHD, is a rare condition affecting an estimated 1 in 4,000 to 10,000 children. It can impact growth, development, and overall health. PGHD occurs when a child's pituitary gland doesn't produce enough growth hormone, leading to slow growth, delayed puberty, and other symptoms. Diagnosis involves ruling out other causes of slow growth through tests like X-rays and growth hormone stimulation tests. Treatment typically includes growth hormone replacement therapy, with dosing based on weight and ongoing monitoring. Early diagnosis and treatment can help children with PGHD reach a healthy adult height. To learn more, visit ghdandkids.com. MDVIP Primary Care Network welcomes physicians in New York and New Jersey. MDVIP, a primary care network, has welcomed 2 board-certified physicians in New York and New Jersey. Dr. Monica Grover, based in New York City and Hudson Valley, offers personalized women's health services, including hormone balancing and postpartum care. Dr. Julie Stern, located in Howell, New Jersey, focuses on preventive medicine and chronic disease management. Both physicians provide same or next-day appointments, 24/7 availability, and comprehensive wellness programs. MDVIP's patient outcomes show fewer hospitalizations and better disease control. To learn more about these physicians or join their practices, visit MDVIP's website.
Biomed News Breaks, Sologenics Inc., SNGX, highlights Highbright progress in CTCL via new podcast featuring Dr. Ellen Kim. Sologenics Inc. highlights progress on Highbright for early-stage cutaneous T-cell lymphoma in a recent podcast featuring Dr. Ellen Kim. Dr. Kim reported a 75% treatment success rate at 18 weeks and up to 85% improvement in patients treated through 54 weeks. The study mirrors the design of the current FLASH-2 trial, emphasizing Highbright's safety and tolerability with no serious side effects reported. The open-label study eliminates rest periods and extends treatment duration, potentially boosting efficacy. Dr. Kim underscored the urgent need for new options in early-stage CTCL, highlighting Highbright as a potentially safer, faster-acting alternative to traditional treatments like steroids, chemotherapy, and phototherapy.
GeoVax to showcase innovative COVID-19 vaccine data at the Keystone Symposia on Vaccinology. GeoVax Labs Inc. will present data from 2 key studies at the Keystone Symposia on Vaccinology, highlighting the cross-reactivity and broad-spectrum immunity of their GeoCM04S1 and GeoVax multi-antigen vaccine technology. These presentations will showcase the effectiveness of their MVA-vectored multi-antigen COVID-19 vaccines in inducing protective immunity against SARS-CoV-2 variants, including the Omicron subvariant XBB.1.5. GeoVax's Chief Scientific Officer Mark Newman emphasized the importance of inducing broadly specific immune responses particularly T-cell responses to viral proteins. The company's participation at Keystone demonstrates their commitment to leveraging next-generation technologies to combat infectious diseases and address emerging variants.
Vensana Capital appoints Maria Berkman as partner and Ross Rusty Segan as venture partner. Vensana Capital, a leading medical technology-focused venture capital and growth equity investment firm, has appointed Maria Berkman, MD, as partner and Ross Rusty Segan, MD, as venture partner. Maria Berkman, MD, joins Vensana after over a decade at Broadview Ventures, where she was director and head of the medtech practice. She has invested in nearly 20 medical technology companies and has a background in management consulting and clinical training. Ross Rusty Segan, MD, brings over 25 years of global experience as a medtech thought leader and physician executive. He previously served in prominent positions in the medical device industry and the U.S. Food and Drug Administration. Vensana's managing partners are excited to welcome Maria and Rusty to their growing team, aiming to build the next generation of category-defining medtech companies. Advanced physiotherapy services available in Chicago. The Movement Guild, a leading provider of physical therapy services in Chicago, offers personalized treatment tailored to meet each client's distinct needs. Founded in 2019 by Adam Wolf, the clinic focuses on individualized treatment plans to help clients regain mobility, alleviate pain, and achieve wellness goals. Specializing in concussion management and men's pelvic health, the Movement Guild's therapists utilize advanced techniques to promote recovery and well-being. With a commitment to community outreach and professional growth, the clinic provides state-of-the-art facilities and a nurturing environment for clients. Trusted by many, the Movement Guild is dedicated to assisting clients in achieving their wellness aspirations and enhancing their quality of life in Chicago. Banner Aetna appoints John Burns as COO. Aetna, a leader in innovative value-based care in Arizona, has named John Burns as Chief Operating Officer. With over 15 years of experience, including a decade at CVS Health Aetna, Burns will oversee daily operations and strategic efforts to provide quality, accessible care. Burns's expertise will help accelerate the mission to deliver cost-effective care to Arizona communities. Through this addition, Banner Aetna aims to offer smoother care experiences and personalized support to members, while streamlining operations for brokers and providers. Burns is excited to join the team and help break down barriers to care, delivering solutions that empower members in their healthcare journey.
Gwinnett Clinic named a Georgia Multi-Specialty Practice Center of Excellence. Gwinnett Clinic in Lawrenceville, GA, has been recognized as a Georgia Multi-Specialty Practice Center of Excellence by Castle Connolly. Only 1% of medical clinics in the U.S. are eligible for this honor. 9 Gwinnett Clinic physicians were named Castle Connolly Top Doctors in 2025. The clinic focuses on providing high-quality, patient-centered care with an interdisciplinary approach. With a 17-clinic network, Gwinnett Clinic offers primary care, specialty care, and ancillary services. Patients benefit from same-day sick visits, walk-in visits, evening hours, and weekend hours. The clinic staff collectively speak 14 languages, creating a diverse and inclusive environment. Gwinnett Clinic's core principles include building strong relationships, delivering comprehensive care, and providing access and convenience to patients. For more information, visit Gwinnett Clinic on social media platforms.
Renowned pediatrician Dr. Miro Ukranchik to join pediatric affiliates, strengthening New Jackson office. Dr. Miro Ukranchik, a highly respected pediatrician with over 2.5 decades of experience, will be joining pediatric affiliates in August at their New Jackson, NJ location. Known for compassionate care and community ties, Dr. Ukranchik's addition reflects the practice's commitment to quality pediatric care in Ocean County. With a medical degree from University of Zagreb School of Medicine and residency at Long Island Jewish Medical Center, Dr. Ukranchik's expertise and patient-centered approach make him a valuable asset to the team. Pediatric Affiliates' New Jackson office, located at 27 S. Cooks Bridge RD, Suite 212, will provide accessible care for families in the area. For more information, Visit pdf.com/home.
June is Parental Rights Month. Mental health watchdog calls Baker acting of children in Florida a parental rights violation. June is Parental Rights Month, and in Florida, the Citizens Commission on Human Rights is calling the Baker acting of children a violation of parental rights. Despite the Parents' Bill of Rights guaranteeing a parent's right to direct their child's mental health, close to 40,000 children were Baker acted in Florida in 2020-2021. While this number has decreased, the practice continues. The president of the Florida chapter of CCHR, Diane Stein, believes the Baker Act is being used for profit and as a disciplinary tool. It's time for Florida to pass legislation to protect parental rights and abolish the use of the Baker Act for anyone under 18. To learn more about CCHR's mission, visit csarf.org.
Thank you for joining us today. That's it for this episode of the NewsRamp Health, Fitness, and Wellness podcast. As a reminder, NewsRamp curates news from leading newswires like Newsworthy.ai, 24/7, PressRelease.com, NewsDirect.com, and BlockchainWire.io. We encourage you to visit newsramp.com to read all of today's news.